Welcome to the Nourish You Podcast, where we question the traditional model of dieting and nutrition and focus on choice, fun, and health for the whole mind, body, and spirit. I'm Jana Maurer, a non-traditional registered dietitian and well-being expert, and I want to challenge you to take 2% of your day today, listen to this episode, and make this your health win for the day. Pop in your earbuds, strap on your walking shoes, or pour a big glass of wine, whatever you need for today, and tune out the world as much as you can for the next 30 minutes, and let's fill up your cup. All right, everyone, welcome to the Nourish You Podcast. Today, I have Dr. Carolina Sueldo. She is a local fertility specialist in the Fresno Clovis area, and she is going to be talking about PCOS today. So thank you so much for being willing to come onto the Nourish You Podcast and provide so much value to our listeners today. So I will let you take over and introduce yourself. Welcome.
Absolutely. Absolutely. Thank you so much for having me. This is definitely something that I'm passionate about. So I'm happy to be here. I'm happy to have this conversation with you. And I know my audience will also really appreciate sort of the dietary and nutrition aspects that come along with our discussion today. So for those that don't know me, I am Dr. Carolina Sueldo. I am double board certified in both OBGYN and fertility. So I like to say I'm a fertility specialist. Our acronym is actually a lot longer. It's REI, or reproductive endocrinology and infertility. So really we cover not only fertility, but all things hormone related within women's health. So I think that's the easiest way to explain it. We love our acronyms in medicine, but basically I'm originally from the Valley. Moved away for a while, lived all over, and then came back about 4 years ago with my husband and now our 2 sons. So I've been practicing in the Central Valley for about 4 years, although I would say my reach, extends beyond that. I was in Florida before, Connecticut before that. I have ties to South America, so a lot of friends and family in Argentina in particular. So kind of a global citizen, if you will.
Yeah, that's amazing. And I'm sure so much context to be able to provide care in so many different ways, right? Like I always say, traveling expands our world in more than just the travel aspect or the leisure aspect. It really helps us connect with just different cultures and the way that we live life. So what brought you back to the Valley?
So my parents are here. My dad actually founded the fertility practice back in, I think it was either 84, 85, right around the time I was born. And he's been practicing here forever. And essentially when I finished my training, I was still single and, said, Dad, I can't go back to the Central Valley as a single person yet. So I took a job in Miami. Really, the plan was to stay in Miami. I had a great time. Being single in Miami was a lot of fun. But then, I met my husband. We knew we wanted to start a family. And, Dad and his partner are looking both to slow down. They're both sort of on the other end of the spectrum of their career. And so it was time, kind of just things aligned, and I moved back. And to your point about living all over, it's been really, really interesting being back in the Central Valley, because I will say we have an extremely high incidence of PCOS relative to other parts of the country. And it's what we call a more resistant PCOS. So I'm glad it's a hugely important topic, not only because it is the number one cause for irregular cycles in reproductive age women, but particularly in the Central Valley, we see it with an even higher frequency.
Why is that?
So we don't know. That's a short one-liner. We do think that there is something related to the ethnicity piece. We know, and that study was actually done by one of my mentors, Dr. Lawrence Engman, where they looked at the androgen pathways, the testosterone pathways and the insulin pathways of PCOS women. There was a very large multi-center study that was done. And when they actually broke it down by ethnicity, they saw that women of Hispanic origin tended to have a more quote unquote resistant PCOS than non-Hispanic women. And there are a few other ethnicities that fall into that category, but I think because of our large Hispanic population here in the Central Valley, I would attribute that, although the underlying mechanism as to why, that piece we haven't figured out.
Yeah. So, I mean, this gets into a really good conversation as far as like the genetic piece or the environmental piece. So, tell us more about like just from as a whole, what are some things that women should be taking into consideration if PCOS is a concern for them?
Absolutely. So, the first thing that I always tell people is that PCOS is considered a multifactorial disease. And what that means is we believe that there are multiple variables that go into causing the disease. So, there's not just one thing that produces PCOS. And so, when you talk about that, just as you very well stated, so we believe that there are environmental factors, so exposures in terms of the workplace or your geographic location, et cetera. We do believe that there is a genetic component, although there hasn't been a single gene identified, but there have been series of genes identified. Familial history, so kind of going hand in hand with the genetics. If you have siblings or parents or other family members who have that disease, that can definitely put you at risk for it. And then certainly lifestyle. So we know that there are certain things that are going to predispose women who may have an underlying risk for PCOS. So for example, obesity being number one. We know that obese women, because of the impact to that metabolic component, they have an increased risk for PCOS as well.
Mhm. So, the power of information is to be able to help you navigate care, right? Like it is not to scare, it is not to prevent or freeze in not being able to care for yourself. So if a female is identifying as, struggling maybe with some weight aspects or has a family history of PCOS, where do they really start? How can they really be able to step into an empowered state when they are caring for their bodies?
I love that. So I think, the first thing, obviously, I'm always going to say is talk to your physician. Typically, primary care providers are going to have some basic knowledge of PCOS, but that's not really going to be their bread and butter. You really want to be talking to your OBGYN. And even beyond that, you may be considering a fertility specialist. Now, I say fertility specialist, really they're hormone specialists. So PCOS is their bread and butter. Whether or not you're trying to get pregnant, that is something that they see all day, every day. So that would really be in the realm, sort of there's multiple physicians that are options, but within that realm, fertility specialists are going to be the most appropriate because they have the most exposure to that disease. So as far as care, that is really where I would go. In terms of online resources, Dr. Google is a vast, vast place. And so I think just making sure that you're following reputable resources, vetted resources, whether that's an acknowledged medical society, whether that is someone who is certified in the specialty. It's really understanding that where the information is coming from. I was told recently, there's a lot of, and part of the reason that I believe that we as certified professionals need to be in these spaces, in these online spaces, is because there's so much information out there the patients are being given that if we're not there, who knows what they're being given, right?
Yeah.
And so for me, that's hugely important that board certified or certified individuals be out there putting out information that is accurate and that is medically and scientifically sound.
Oh my goodness. I feel like I could get on my soapbox on this. So I recently came across, I think it was like 64% of individuals now receive their health information from social platforms. And which is it, and it also changes how they interact with healthcare, which can be good, right? Like if they are getting that information that it is reputable and is science backed and is repeated over and over again versus kind of the maybe more of the influence. Although we all are influencers in different ways,
Sure.
but that is kind of putting that agenda based behind it. So I think that's so key to be able to give that accurate information. So for someone that is tuning in and has thought like, oh, I just don't know, like what are some symptoms that maybe we can connect them to of like, this would be, if you are having these symptoms, this would be an excellent time to be able to reach out to your physician.
Yeah. So, I think I'm going to start with what is PCOS, because I think it's such a buzzword, as we were talking about before the recording started, that people just automatically go to it. And I think there's so much more that actually goes into it. So the first thing is that PCOS stands for Polycystic Ovarian Syndrome. And many women believe that it is cysts on the ovaries, and that is not true. So essentially, because it is a syndrome, it is a constellation of signs and symptoms. And if you have enough of them, then you fit into that diagnosis. And probably one of the most accepted diagnostic criteria is something we call the Rotterdam criteria. And so Rotterdam is a place in Europe. A bunch of experts got together and said, hey, let's unify what we're talking about when we're talking about PCOS for the purposes of research, for the purposes of the studies, but also in terms of counseling patients. So the Rotterdam criteria talks about irregular cycles. And when I say irregular cycles, I'm talking about, the technical term for that is oligomenorrhea, where you're basically having cycles every 2 to 3 months. They're definitely not regular in any predictable way or fashion. And really, this is something that you've struggled with chronically. So it's not something that's sort of new onset in the last month or two. This is something that you've probably been dealing with for a little while. Mm-hmm. Number 2 is the definition of polycystic ovaries on ultrasound. And that the easiest analogy I give to my patients is, think of a chocolate chip cookie. So we're looking at how much cookie, and we're looking at how many chocolate chips. So it's not really cysts on the ovaries. We're really talking about an egg excess syndrome. So because there's so much present, so many eggs, so much volume, that you tend to have a system overload. Okay. So that's really what we're looking for when we do the ultrasound. And then the third thing that's just as important is either clinical or laboratory signs of hyperandrogenism, AKA high testosterone. So in blood work, your provider is probably checking for testosterone and a few of its cousins, as I like to call them. The technical terms for those, DHEAS, 17-hydroxyprogesterone. I won't bore you with the technical stuff, but there's a whole panel of things we're looking for. But clinically, some of the symptoms that you may complain of are head hair balding. So patients talk about hair thinning. They may have, areas of baldness or alopecia like you would see in a man. On the face, they may talk about acne or male pattern hair distribution, where, they're shaving or they're waxing or they are lasering in a regular fashion. That also may occur on the chest, in the inguinal region or groin areas. And then there can also be some metabolic components. So we tend to talk about darkening of the skin behind the neck or under the axilla or breast areas. That's what we call acanthosis nigricans. That can sometimes be a sign of insulin resistance. We also talk about central adiposity. So when you do have weight gain, it tends to be more in the abdominal region. Difficulty with weight loss. Those are some of the metabolic components of this. But generally speaking, the Rotterdam criteria is going to be 2 of the 3 that I mentioned. So irregular cycles, polycystic ovaries on ultrasound, or the elevated testosterone clinically or in blood, and then obviously ruling out other causes, of course.
Mm-hmm. Well, and I also like how you pointed out that this is something that is likely been happening for a longer period of time than 1 to 2 months. I think that that's very key because, our bodies are meant to naturally fluctuate, and there can be changes. But if this is something that is routinely occurring, this could be a great opportunity to start that conversation with your physician if you have not. So if this is something that they were diagnosed with PCOS, what are some of those, you're really big on this, and I absolutely love this. From a physician perspective, I'm like, yay, this is so exciting because there's a lot of management that happens outside of the clinic, right?
Yes.
Or outside of going to your doctor's checkup. You're really managing in so many different ways from your home or in your lifestyle. So if someone is concerned with this or they have been diagnosed with PCOS, from those lifestyle aspects, what are some, key things that you share with your clients?
Yeah, I'm really big on sort of the holistic. And when I say holistic, I mean whole person approach to medicine, right? Because as a physician, I'm going to have one touch point in a very defined amount of time. And I'm doing a very specific treatment, but I feel like there's so much else that is going to complement that. So when I talk to patients about the management of PCOS, we talk about, okay, what is the medical management going to be? And that's where I'm involved. But then also what supplements may be indicated for your particular diagnosis, and then what lifestyle changes can be made to optimize your care and sort of improve or enhance your response to the other two things, to the supplements and the medical treatment. So when you focus on lifestyle, there's really a few key components. Of course, one is the common sense stuff, right? Alcohol, tobacco, chewing, vaping, etc. All of that is only going to worsen or exacerbate your signs and symptoms. So you definitely want to make sure that you're focusing on optimizing just your general lifestyle exposure, substances, however you want to call it. But then the second thing is really going to be related to your nutrition and to your exercise. So for example, in the setting of PCOS, a typical statistic that I will give to patients is that patients with PCOS are at a 4-fold higher risk of developing diabetes than somebody without PCOS. And that is irregardless of their height and weight. So even if you are normal weight, quote unquote, right, that you have a 4-fold higher risk of insulin resistance just because of your underlying PCOS. So you're going to have to be a little bit more careful, a little bit more watchful than somebody without PCOS. And so really attacking this from a multidisciplinary approach, I think is so important. And I would sort of throw it back to you, Jana, from a nutritional standpoint, what are some of the things that they should focus on if they do encounter this diagnosis?
Well, I absolutely love this that you mentioned that even if you are normal weight, because I think that that is a huge shift in mindset of like, oh, well, if I just lose weight, then this should be fine. And a lot of times that is not the case because insulin resistance is completely different than losing weight, right? Like there's two different conversations that are being had. And this is why one of the reasons why I focus on weight, but that's not the only indicator that I'm looking at because I really want to focus on individual behaviors because that's going to be able to help across the board with management, not only from an insulin resistance perspective, but also when we go into even stress management, right? Like the infertility process or the fertility process as a whole can be very, very stressful. And so by being able to broaden our definition of how we care for an individual, we can really support them from that whole person approach that is not solely focused on lose 10 pounds. And that goes into why we focus on behaviors. So I would rather focus on someone being able to set a goal and accomplish that goal and consistently be able to show up to that goal of walking versus someone that is hyper-focused on a fad diet and able to lose 10 pounds in a month. Right? Like I am way more focused on that individual that consistently goes for a walk after lunch because that has been shown to be able to reduce blood sugar levels post meal and been able to show to regulate those blood sugars throughout the day versus someone that can show me that they're going to do a fad diet.
Exactly.
So this is really where it gets into that environmental component, the behavioral component, and the lifestyle aspects.
Yeah. I'm sorry to interrupt you, but I just want to I really want to impress upon your listeners just how important this is. So for me, when I have patients who come to me and they're actively trying to conceive and there are optimization things that can happen, if we have the wiggle room from an age standpoint, I will honestly tell them, look, in the money that you have saved up to spend on this treatment, I want you to go and invest that money in the behavioral changes that you're mentioning right now and come back to me in 3 months. And I don't care what the number on the scale is, but you're going to come back to me in a better state of health for you, in an optimized state of health for you. And then we can start treatment and then we can really tee you off in a more optimized way, which is only going to improve or enhance your chances of success when you work with a specialist.
Mm-hmm. Well, that's a really big shift too.
Yeah. And people, I think they underestimate just how important this piece is. But we, on the medicine side, we have tons of data showing that if people can improve their health, if people can optimize, again, we use weight. It's not a great indicator, but it's what most of us use. But if they can improve their weight, if they can improve their nutrition, if they can improve their insulin resistance, we have even seen patients who have started to have cycles on their own and don't even need fertility treatment down the line. Or, let's say they're not trying to get pregnant. Those patients have been able to normalize their cycles without the need of birth control pills or other hormone medication. So I really, really want to impress upon the listeners just how important this is, because obviously you want to complement, right? Like always you want to be doing the medical thing. You want to be talking to your physician. But I think people are like, oh, well, I know what to do. I know what to do. And then, but yes, you do. But then that accountability piece is missing. And so they come back to me in 3 months and like nothing has changed. Mm-hmm. So sorry, I had to interrupt you because I think that it's just that important from a from a provider side or from a physician standpoint. When I'm treating someone, if they can be optimized before coming to me, it's only going to make our relationship and our management that much easier and better.
Yeah. And do you feel like that is something that individuals struggle with, is to be able to implement that lifestyle aspect? Or what do you feel
1,000%.
like? Yeah.
That is probably the hardest thing, right? Because from a medical management standpoint, if I'm giving you a prescription, or if I'm telling you have to come in for visits, or if there's, I'm sort of telling you what to do, for lack of a better term, you don't really have a choice, right? The accountability doesn't have to be there because I'm making you accountable. Versus the lifestyle piece, I think so many people try to tackle it solo or without help. And I try to compare it to, we all know like what we need to do, right? I mean, even myself as a physician, but when you have the accountability piece with whatever, a trainer from an exercise standpoint, a dietitian from a nutrition standpoint, a regular acupuncture visit, whatever that looks like from a holistic approach, you have that accountability. The likelihood of success and the likelihood of long-term behavioral change has been well documented and proven. So for me, that's how strongly I feel about it. Now, there are other circumstances withstanding, right? So if the woman is older, if there are other, factors playing into it. But if, let's say I have a woman in her mid-20s, newly diagnosed with PCOS, and we know, she and I have had conversation, and we know that there's an opportunity for optimization. Like, I would much rather she make that personal investment in herself outside of my office and come back to me in 3 to 6 months optimized. Does that make sense, what I'm trying to convey?
It totally makes sense. And I love that you're having that conversation to be able, like, as you were speaking, I'd really just think about like the ownership aspect of it, of individuals' health journey, right? Like, so you are giving them, like, I fully believe in equipping, guiding, supporting individuals, but ultimately they have to take ownership of their health, and versus oftentimes, like, and correct me if I'm wrong, but when we go into the physician, it is like those do or die moments, right? Like, and so it's like, you have to provide a solution that is like a temporary fix. And it can only last so long. This is where I say, like, it really does take, if you need medication, we certainly want to have adherence to the medication that you need. We also need to have the lifestyle modalities in there with the diet and the physical activity. When we have all three of those in alignment, you are taking care of your health, and you know that next best step for you, versus feeling very confused and overwhelmed in the medical setting, which is a common theme that I hear a lot of, like, I just don't know what to do. And that becomes very overwhelming. And that's not the goal, right? Like, we want to equip, we want to educate, we want people to be able to ask these questions, to say like, well, actually, I've done this, this, and this, and here's where I'm struggling. Or, okay, now we need to shift the medical plan because we have done all these things. And so now it looks completely different. This is where we really allow people to advocate for their own health. And again, that is not only done in an office setting, but also what they do on a daily basis. They're advocating for their health. So I love that you're giving them that opportunity to be able to do that. and know that like you're there too. Like, okay, yeah, but we're going to follow up and see how you're doing. And then we'll take that next step.
Piggybacking off of that. Exactly. Piggybacking off of that. Like for me as your physician, if you come in and say, well, I'm already doing X, Y, and Z, and I'm already at my like best place. Okay, then that's where we are. And then let's focus on, adding to that. So, yeah. And I love, you mentioned something that I think I see a lot in my office, which is the control piece. And for women, for all of us really, having a monthly cycle is, something quote unquote natural, something that we're quote unquote supposed to be able to do as women. So when we don't have that, regardless of trying to get pregnant or not, there's a sense of loss of control of our bodies, right? Mm-hmm. So having irregular cycles, getting 2 periods a month, like, oh, I'm so abnormal. What's wrong with me? What's wrong with my body? All these sort of negative or shameful thinking that comes associated with that. And feeling like you're not in control of your own body. And so I do think that empowering you, and I'm all about empowerment, with the tools necessary to say, okay, I went to my doctor, they told me I have PCOS. What does that mean? How did they arrive at that diagnosis? And then what am I going to do about that diagnosis? So, there's another sort of trap that sometimes providers fall into is like, oh, she's young, she has irregular cycles, she has PCOS, just by looking at her. And, agreed, it is the most common cause, but there is actually a workup and an evaluation that goes into that. You have to exclude other things, et cetera, et cetera. And so really empowering the patient to say, okay, this is the label I've been given. How was that, decision made? And then how can I take back some of that control? And so all the things that we're talking about today is really about sort of regaining, that control piece and regaining some of that autonomy when it comes to your body and the decision-making that comes with that.
Hey everyone, it's Jana, and I wanted to interrupt your content real quick to tell you about something that I've been using every single day, OWYN protein drink. I've been using it for the last year now and absolutely love this product. It's been something that's been so helpful to meet my protein needs, to meet my calorie needs, and to meet my overall nutrition and performance goals. I am super picky when it comes to recommending different products or supplements because I take a whole foods-based approach. So I highly encourage you to check this out for yourself, see if you like it. I do have a discount code for you. You can click the link in the show notes below. At checkout, you can put JanaM20 to get 20% off and check it out for yourself. Now back to the episode. Yeah. So this brings up two things that I see on my end. I see a lot of the emotionality aspect. We are emotionally connected to food in so many different ways, and that impacts how we ultimately interact with it. But then I also, like when you were sharing earlier, okay, so we see this higher incidence in those that are classified as being obese. Mm-hmm. And also I heard you say that maybe you can better manage without changing the scale. So how do those things go hand in hand? Because ultimately, so how I hear it said is I did this to myself, and then guilt and shame sets in. And then actually we revert backwards and we don't engage in self-care because there's this self-loathing phase that happens of like, well, I did this to myself, so I don't deserve to care for my body. So how can we put this into a little package, right? Like that's easy to digest and put a bow on it and say, okay, here, if this is how you are feeling at this moment, here's what you can do. So break that down for me.
So I think there's a couple parts to that answer. So the first thing I will say is I always come back to, you have to remember that PCOS is a medical disease. It is an underlying medical issue that is multifactorial in origin. And that when we talk about weight or when we talk about high estrogen associated with obesity because of the fatty tissue, et cetera, that is one component of it. If you optimize that doesn't mean the PCOS is magically gone. You've just optimized that. There are patients that are going to be predisposed to PCOS, even if they're not overweight. And there's going to be patients that are overweight who don't have PCOS and who have regular monthly cycles every month. So I think it's important to sort of tease out and separate that yes, yes, it's true that there is a component of this, but it's not the only component, right? Like this is not, I did this to myself. Peace and infertility very much has a lot of those same thoughts that you were just mentioning. This is not something that you did or that you caused. What we're talking about, so always in the context of PCOS, infertility, insert the diagnosis. These are all medical diseases or medical issues that are underlying at baseline. So when we're having these discussions about weight or optimization, we're really trying to say, okay, this underlying piece, this PCOS, that's not in your control. You did nothing to cause that. And that's why we talk about the supplements and the medical management and all the things necessary to address that. What we're talking about is this third arm of lifestyle that we know can impact or worsen or what's the other word, trigger or that can potentially impact your diagnosis. And so how can we optimize or improve upon that aspect so that we are doing everything that is in our control to optimize the things that are not in our control? I don't know if that makes sense.
Yeah, I think that that's a really good delineation because something that I commonly say is with nutrition, it's all relative. It's all relative to the individual, right? Like, so just to be very, very clear, there can be someone that is of healthy, normal BMI and still diagnosed with PCOS. There can also be someone that is classified as obese on the BMI scale and is also diagnosed with PCOS. So this is where we really get away from, okay, weight is part of the equation. It's not the entirety of the equation. And there's more that we can do for you from a medical management perspective as part of your care team, right? Like, so this is where we really want to expand that conversation. The reason why I wanted to go back to this is because oftentimes it's like we're stuck in the rut of focusing on the scale, and the scale is the only way that we indicate that we take care of ourselves versus actually being able to expand out and be able to ask these questions far beyond the number on the scale to be able to, again, manage the condition at hand. And that's a completely different conversation. And a lot of times, many of us have not been equipped of how to do that outside of, well, you're just this type thing.
Right.
And so I want to be very clear that from a weight perspective, it can be both.
Right. And I'll take it one step further beyond sort of the weight piece of things and say that we know, and there's data to support that women who have PCOS have higher rates of anxiety and depression. And so it's almost like this vicious circle of, I'm having these feelings that might trigger the increased risk of anxiety or depression, and sort of they feed off of each other. And so acknowledging that and then being proactive about, seeking help in that aspect and making sure that that mental piece is also well controlled. That's going to be another component that we're going to be talking about, right? So here we're focused on medical, supplements, lifestyle. Well, that anxiety, depression treatment, that'll fall under that medical piece as well. And we know that patients with PCOS have higher incidence of those diseases. And then one other thing I'll just mention, I was talking about this last week, was night shift workers. So I did a quick review of the literature, and they have increased risk of irregular cycles, increased risk for PCOS. It's not well understood. We know it has to do with, hormone imbalances and endocrine disruptors and whatnot, but we don't fully understand it. So when we talk about lifestyle, we tend to focus on the nutrition, on the exercise, but we're looking at the whole thing, right? Like, so my firefighters, for example, my guys who are firefighters, they have increased risk of male infertility, my long distance truck drivers. But there's also data on night shift workers that's pretty good, on men who work at hair salons and they're exposed to those toxins day in and day out. They increased risk for infertility. So I think when we talk about lifestyle, I think the nutrition piece and the exercise piece are easy things that we go to, and the kind of falls in line with that. But we're really talking about the whole aspect, the whole picture.
Oh, well, I think this really brings up, like, really being able to expand the conversations that are had too. Like, a lot of times I'll hear individuals, like, I'll ask them, I'll say, did you share this with your doctor? And they said, no. Why did they need to know that? Well, because like you said, like, I've had an individual that changed from day shift to night shift and he gained 20 pounds, literally just with that one shift. But his doctor had no idea. And he was
Right.
like, well, that doesn't impact me. It's like, yeah, yes, it
Yes,
does.
it does.
Big time, right? Like, so when we're really looking at our health, there are many different like factors that impact how, like, basically how our body functions, right? Like, this connects to our circadian rhythm, this connects to our stress hormones, this connects to our hunger hormones, leptin, ghrelin. I mean, literally, it's a cascade of hormones that are like taking taking
Yeah.
the blow, if you will, from
Yeah.
what we
Yeah.
consider small changes.
Yeah.
And I'm air quoting that
Absolutely.
small.
Absolutely.
Okay, so I do want to give, like, just, as we start to wind down for today's conversation, I feel like this was so good because really you are expanding what is made okay to have have a conversation with your physician. I know, I know you guys are so busy and maybe, just your 2 cents on this. Like, what do you feel like is the change in healthcare? Because I'm hearing more and more physicians really start to talk about this lifestyle component outside of, traditionally what we say of, like, just take a pill. Like, I've heard so many people say, I don't go to my doctor because I don't want to take pills. And it's like, well, there's a lot of other reasons why we go to doctors, right? Like,
Yeah.
so
Yeah.
how can we continue to change this narrative around the profession?
Yeah. And I think and I'm probably not going to give an adequate answer, but I will give sort of like you said, my 2 cents on it. And I think there's two pieces to this, right? So one piece has to do with the way that healthcare is practiced in this country. And, really for most physicians who take insurance, that's going to be volume-based care. Insurance reimbursement is so low that they have to do volume-based care to be able to have a profitable business model. And so with volume-based care, you're really just not able to have the conversations that need to be had. So that's one piece. I think in my world, because there is sort of a move away from insurance, and not that I'm happy about that, but that's a conversation for another time, I'm able to have those longer visits. So I'm able to spend 30, 45 minutes really taking a deep dive into the entire person, and spending all of that time talking specifically about this one aspect of their health. It's not like I'm trying to cover a full annual exam in a 30-minute consult. So I think there's kind of those two aspects of it. And then the third thing is that I think that we are starting to pay more attention to this. So as we have seen the obesity epidemic become more and more common, we have begun to tie that down to medical diseases. So we're starting to pay more attention than we did maybe 10 or 15 years ago. So I know for sure in the PCOS fertility world, we now have more and more data and more literature in the science world to sort of back up what we've been thinking about for a long time. And so that's why I think now it becomes sort of more important to talk about, because we now have the studies or whatnot to back it up where we maybe didn't before.
Yeah, love that. It takes time, right? Like, it takes time to gather this information and to be able to implement change. It does take time.
And there's a whole movement within the medical community to go to basically direct to consumer care and moving away from insurance. And it's the minority right now, but the tide is certainly starting to swell because of this very reason. Like, those of us that went into medicine, we want to help people. We want to impact and affect change, and, not really being able to do that in the way that medicine is currently practiced. So there's definitely, I think that there's sort of inklings that things are starting to change as you start to see more and more DPC providers come about.
Yeah. Yeah. Okay. So let's keep it to 3 aspects. There's so many different things that we could talk about. What are the top 3 things that you wish women knew, understood, focused on to be able to manage their care in this realm?
That's so hard.
Yeah.
Okay. So I think can I add, I'm going to add like a half in there.
Sure.
I think sort of a first thing is that if you are a reproductive age female and you are otherwise healthy and you're not taking any hormones, you should be having regular monthly cycles. And if you are not, That is not normal. And that is something that, merits evaluation. Whether or not you're trying to get pregnant, whether or not you actually care about your cycles, you should be having regular periods as a healthy reproductive age woman. So that's just my little aside. Specific to PCOS, I think the three big takeaways are: number one, make sure proper testing was done. Ask, inquire, ask to see, okay, what testing was done? What do we need to do to actually confirm that I have? You can't just walk into an office, tell someone you have irregular cycles and get diagnosed with that. So that's number one. Number two is, I think when you're talking about PCOS, it's really important to understand that whole person approach that we've been talking about. And so really breaking it down with, the medical aspect of things and how that's being managed by your physician, the supplements, which we didn't get into today, but can also potentially contribute. And then finally, this lifestyle piece where we spent most of today talking about is so important, that and really sort of that autonomy and empowerment of, I don't have control of my PCOS, but I do have control over all these other things and optimizing all of these other things.
Yeah. Love that.
And I think the third thing, my thing is always, I want to empower patients, and I want you to be your own advocate. I want you to be a self-advocate to say, okay, if my primary doesn't really know what to do with my irregular cycles and PCOS, let me talk to my OB-GYN. If my OBGYN is like, well, let's just do birth control, okay, what else or what other things can be done? Well, then maybe I need to seek out somebody else. And again, I come back to fertility specialist because that's kind of the term that is used for us. But PCOS is our bread and butter as hormone specialists. And that's what we see all day, every day. And it's certainly within a fertility specialist purview to diagnose you, to manage you, and counsel you through that aspect of your disease.
Gosh, I feel like we could go on for 3 hours, because you brought up another really, I'm seeing this trend online too. And honestly, I just kind of sit and watch, because I don't know what the answer is. Of a lot of women are getting off of birth control and are kind of really speaking out against that line of treatment, and did not find it to be useful. So maybe that's a topic for another day, but I would love to hear your take on that as well. Just again, from that bigger picture.
We could spend a whole other hour just talking about that.
Yeah. And if listeners are interested in that, I would love to hear that feedback too, because to provide that information is really key. Okay. You mentioned a half. What would that half be? 3.5.
No. So the half is kind of going pre-PCOS.
Gotcha.
And just going if you are a young, healthy, not on hormones person, female, I should say, you should be having regular monthly cycles. And if you're not, then that needs to be investigated, regardless of whether you're trying to get pregnant or not.
Love it. Love it. And then I just want to add, my 3 that I see often. And I love that you said, regardless of if you're trying to get pregnant or not, because I think this is key for females as a whole, of how do you take care of your body? That is the number one question that I oftentimes ask individuals. And particularly if this is a concern, but if this is across the board, there's so many different ways, managing hypertension or diabetes or insulin, sensitivity, whatever it is. There's so many different lifestyle modalities that really do address so many different aspects of us caring for our bodies. And so first and foremost, as it relates to females in particular, I always like to say, eat your breakfast. So breakfast, and you're managing your blood sugars throughout the day, having that regular, cycle, if you will, because we're all cycles. There's so many different cycles in our bodies that are happening on a routine basis. And this is where I just say, thank you, body. You are doing amazing things, even when I don't know. But to have a really high protein breakfast, at least 20 grams of protein in the morning, has been able to, again, connect to our hunger hormones, leptin and ghrelin. It's been found to help with reduced binge eating that usually happens at nighttime. And it really helps balance out our blood sugars throughout the entirety of the day. So that's the number one factor I always like to go after. And also, oftentimes people skip that meal, or, they're just doing a lot of other busy things in their lifestyle. And so that that does go on the back burner. Number two, I say movement is medicine and walking is healing. So first and foremost, getting more movement into our day, it can really change up so many different aspects, again, regardless of if there's a change on the scale. But when we look at being able to move our bodies at least for 30 minutes, 5 times a week, that's the base recommendation, 150 minutes per week. We see additional benefit at 300 minutes per week. So this is not something that has to be, like 2 hours in the gym or whatnot. Again, 30 to 60 minutes, 5 times a week will really have a huge impact on how you feel about yourself, even connecting it from that mental health perspective, the anxiety, the depression. We see so many different changes in how we view ourselves when we can get active. And I always like to say, as much as possible, get outside when you're getting that movement factor in as well. And then I think number three, there's just so many different ones that we could go with, but sleep is a big one. And that we're finding so much more research on the power of sleep and being able to rest, of making sure that we are getting those 7 to 9 hours of sleep. And this is where I like to say, we go after that low hanging fruit. Which one do you feel like you can accomplish today? Right? So maybe these are some goals that we are going to look at a month, 2 months from now, but what is that one thing that you can do today that we can start implementing and be really consistent with? But even from the sleep factor, some people will say well, Jana, I want to lose weight. And so I need to look at my food factor. And it's well, here's the connection. When you are getting adequate sleep, we not only see cortisol levels go down, we see additional stress hormones go down. It changes how you interact with your food, and it helps you with making different decisions throughout the day. And so it also impacts your hunger hormones as well. And so when we are setting these lifestyle these lifestyle goals, we are, in a roundabout way, we are still addressing nutrition, because you're not siloed. You are not in only this area. Every area impacts the other area. This is the whole person approach. And so when we set one goal, it has a snowball effect into many other goals. So those would be my three things that I want to share with, women. Also men, right? These are lifestyle factors that can be for anyone, but usually when we get those
across,
when we get those three things in line, or really, in where we are focusing on them, we see drastic changes. And
I would love to have you on my channel, because there's so much out there about intermittent fasting and keto and so many trends out there. And I would love to chat with you more, conversation for another day, about how this impacts PCOS and sort of what is really the best approach for that. So definitely, I know we've run out of time, but you're coming onto my channel next.
Well, let me just finish with that. If PCOS is a concern, intermittent fasting and keto are not recommended. I will be very clear about that. And yes, I would love to continue that conversation, because it's a really big one right now. Well, thank you so much. Again, we could, carry this conversation on in so many different ways, but I do feel like we've, provided so much value for individuals. So if they want, or, would like to reach out to you or follow you, I know you're on Instagram. Where can they find you?
Yeah. So I talk about my bingeable material. I'm on YouTube, so they can search me. I have my own YouTube channel, Dr. Carolina Sueldo, super easy to find. If not, Instagram and Facebook. I'm definitely much more active on Instagram. Dr. Carolina Sueldo, I have content going up regularly, and they can always DM me. I do have a free webinar at the end of month. It's coming up. It's posted on my Instagram page. They can definitely go there, link in file to join. It's the last free Q&A session I'll be doing. So definitely want to take advantage and get all your questions answered.
Awesome. Well, I really want to honor you today for your ability to expand conversations. I think that this is so impactful on not only your clients, but also our community to be able to care for themselves. And so I really want to honor you for, stepping into that role, because I'm sure it's not easy. And, being an advocate for women as a whole. So thank you so much.
Thank you so much for having me. This was so fun.
Thank you so much for taking time out of your day today to tune in. If you loved today's content, leave me a review letting me know exactly what you liked best, and remember to share my podcast with others to join the Nourish You community. If you want more great content like this between episodes, I encourage you to join my mailing list. You can click the link below in the show notes or check out my website at www.healthwins.org, and let's stay in touch. Until next time, I'm Jana. Talk soon.